Welcome to San Antonio, everybody. I hope you had a good time on the Riverwalk yesterday. It was a beautiful day. The forecast for the next 3 days and for the next 5 months is summer. So I hope you can dress accordingly. I want to say I don't have anything to disclose other than I'm very happy to be here, and I'm thankful to Larry and Ray and the program committee for inviting me. They asked me to start with a few mentoring comments, and as I started to reflect on my mentoring history, and this is probably against the spirit of the thing, but these are some anti-mentoring tips. So in previous years, these were the few that I got. Get nicer shoes. These are my top 3, probably. Get nicer shoes. The second one, 3 words for you, Bob. Tireless self-promotion. Now, as a card-carrying introvert, those 3 words sound to me like tireless self-flagellation, and so I've had a hard time with that. And the last one is wake up at 4 o'clock each morning to write. And at that stage in my career, this was about 20 years ago, the only things I was doing at 4 a.m. was delivering babies and changing diapers. So I did none of those. I did not get up at 4 a.m. in the morning to write. But I want to talk about the antithesis of anti-mentoring now. And she, in her way, came and sat with me at the table to help calm me down this morning, and that's Sandy Burge. And I'm sorry for this, Sandy, but shoes, not so special, sorry. Self-promotion, I've worked down the hall from 17 years, and I have to say she's not big on blowing her own horn. And she appears to be like me and like the early evening writing slot. But as many as you know, Sandy is a fantastic teacher and a great role model, and is just full of wise and calm advice in any situation. And so when I'm in the middle of a crisis, small or big, often at the end of the day, I'll wander down the hall and knock on her door, and she always helps me out. So thank you for that. Okay, I want to start with just 3 big ideas that I'm going to layer a lot of details under this morning. And so the first one is a great half-truth. And what makes something a great half-truth as opposed to a random, run-of-the-mill half-truth is that if we act on a great half-truth, we do a lot of harm. And the great half-truth is that health is a matter of personal responsibility. And we hear a lot about that. I'm going to talk about that. The second one is a particular way of defining health, and that's health as the opportunity to pursue the goals you value. And I'll talk about a stream of research and a way of talking about that in the community that I found useful, using that framing of health. And the last one is the healthy commons, which is the big theme of the talk, helps promote health for everyone, and it reduces disparities. So the Gallup organization actually helped me out a few weeks ago by releasing their survey results, and probably a lot of you saw this in statistics around the country. So San Antonio is the 2nd fattest city in the country. This is from our local TV news. Now, being a researcher, I wanted to see if that was actually true, so I downloaded their own data from Gallup, and that's not true. We're the 2nd fattest city of the 1 million plus cities. We're actually and here's the data. Each line here is one of the metropolitan areas in the United States, arrayed in order of obesity rate, and we're the red dot. And I can tell you that we're only the 24th fattest city in the country. But that's still nothing to brag about, and so I'm going to talk about what we're trying to do about it. Now, health is a matter of personal responsibility. I want to take 2 slides to try and demolish that idea the best I can. These are data from the National Health and Nutrition Examination Survey, taken about 30 years apart. These are directly measured heights and weights. This is the bell curve of BMI in the United States. And you can see there was a shift in the entire bell curve over that generation. The skinny people are now less skinny. The average people are overweight. The overweight people are obese. And the obese people are more so. And what's happened in the United States is really just a slice of what's happening over the whole world. These are worldwide obesity statistics over that same generation. And places in the world, now starvation by no means has disappeared. It's still a problem. But places in the world that used to have big starvation problems 40 years ago now have obesity problems. Interesting factoid, China now has more pre-diabetics than we have Americans. So just exploding rates of obesity in the developing world. Now, we could frame this as a massive breakdown in global willpower, right? If it's personal responsibility, It's about that. More or less simultaneously, people all over the world just decided to let themselves go over a generation. But we're not going to do that. And the best thinking for what really happened, is this. From the start of the 20th century to about its midpoint, there was just a decrease in physical activity as the way we make a living, the way we do our housework became much less active. Fewer lumberjacks, fewer farmers, more office dwellers. We use washing machines instead of washboards to clean our clothes. And so this is a graph of actually the food supply per capita in the United States, and it decreased over the first half of the 20th century. As people worked less and were less active, they needed to eat less food. And then a switch flipped about 1970, and people started to eat more. And the idea is that the people who make food basically decided and learned that they could sell us more food and we would eat it. So people are eating out more. The portion sizes, if you look at those pictures of what a hamburger was in 1960 and a 7-ounce soda versus a 20-ounce soda, they found ways to double and triple the amount of food that we were taking in various venues. And so those two trends, the falling activity and the rising intake on a global scale, is responsible. And so that's really about the structure of everyday life. That's not about personal responsibility. And I'll give you a few examples from my own everyday life. This is a picture of a strip mall a few blocks from my house. And it nicely captures all the paradoxes of modern days. So this is, in the strip mall, there are 3 restaurants. There are 3 fitness facilities, a dance studio, a gym, and I think it's a karate. There's an auto care center, all in an environment that's completely built for the automobile, right? This is not a pedestrian-friendly landscape. And if you look at the north side of San Antonio where I live, this is an aerial shot from Google. The neighborhoods are mainly blind cul-de-sacs. So if you want to walk somewhere to get your morning paper or a loaf of bread, you can't do that. These streets really lead nowhere, and you need a car to navigate the half-mile that it'll take you to get out of your development. And so as a result of a lot of the country looking like this nowadays, about 1/3 of Americans take no walking trips per week. 1/3 of us don't walk anywhere for a reason other than maybe to walk around the block for its own sake. But no one takes a utilitarian walking trip. And about another 1/4 take less than 2 utilitarian walking trips in the average week. If you walk a few hundred yards east from that first strip mall I showed you, you come to this. On the right side of the slide, you see there are 3 schools, 2 public schools that my kids attended and a church school. And then most of the traffic is heading west in the late afternoon when busy parents are getting off of work, picking up their kids. And they have to drive past that murderer's row of fast food restaurants. And it's obvious what the line of least resistance is if you're tired and you want to get something on the table for the family that evening. And they're even all conveniently located on the side of the street where you don't have to turn left across rush hour traffic. I mean, I'm sure that's no accident. They think these things through. And we know that those establishments market heavily to a particular demographic. This message here is unambiguous. Maybe more distressing is if you go into the schools and you see what they're feeding the kids, you see stuff like this. This is Frito pie, which somehow meets all the USDA requirements for macro and micronutrients for school meals. But yet, teaches our kids all the wrong lessons about how to make an entree. You rip open a bag of snack food, you layer it with beef and cheese, and you're ready to go. Now, and there's a reason the meal looks like that, right? We have this USDA surplus food program that buys stuff that big agriculture can't sell to grocery stores, and it sells it at low rates to schools so they can make lunch out of it and feed a lot of disadvantaged kids, but anyone else who's buying the meals at the school. And this is a screenshot from the USDA website. And you can go there and scroll after page of stuff like this. So beef patties, ground, irradiated, raw, frozen in a 40-pound tube. Or beef patties with SPP soy protein products. So Big Ag gets a twofer on excess beef and excess soy protein that they can give to kids. And you've noticed it's home style. So I don't know how many of you make mixed beef and soy protein products at your homes, but I generally don't. And the last feature of everyday life I want to show is, again, I think a perfect crystallization of the food problem in one picture. This is very cheap food. It's everywhere, the vending machine. There is the There is the ode to personal responsibility at the top. If you can see it, it says choose sensibly, okay? There is no sensible choice in that machine, I promise you. And what adds to the perfection is the shameless manipulation at the bottom. You see healthier alternatives, okay? And I promise you can shake that machine as long as you want, and the kiwi fruit will never come out of it. So that's modern life in a cartoon version in a few slides. So what do we do? And I'm going to tell a local story today, and I think what is a hopeful story about remaking our world in a different way. And you know, every story has an arbitrary starting point, but I'm going to start in 2010 in San Antonio when we got a $16 million two-year grant from the CDC and the Communities Putting Prevention to Work program. And many of you may have been in communities because these went to about 50 states, territories, cities, rural areas around the country. So many of you may have been in areas affected by CPPW. Now, the reason the CDC had this money to give out, which was about $650 million over those 2 years, was the Great Recession, right? This was American Reinvestment and Recovery Act money. And so there's even a pun in the title, Communities Putting Prevention to Work. Get it? People work in prevention and lift us out of the recession. Now, $16 million is a lot of money for public health grants, but if you think about our city, that's $8 million a year, that's $5 per person. That's the investment, $5 per person per year. And the grants were aimed at two things, reducing obesity and reducing tobacco consumption. The excess cost per American for obesity that the CDC calculated for obesity and tobacco consumption are $1,000 per American per year. Okay, so that's a very high ratio of investment against what we're trying to battle. The food companies spend about $35 or $40 per American per year on advertising, and the tobacco companies spend about 50% more than that. So we're at the last CDC meeting for CPPW that I went to. I went with the implementation group every year. Tom Frieden, the director of CDC, got up and said, "There's never going to be this much money again, or at least until the economy tanks in a major league way again." And so that's a statement about two things. One on the negative side about how little public investment there is in stuff like this. And on the positive side, as I'm going to show you, the big differences that public investment at a crucial time can make for a city. So that's the good news. What CBPW paid for was for the city to convene a set of partners. And these are partners that usually don't think about health, many of them, and usually don't work together in any coordinated way. So the Parks and Recreation Department, the Public Works, the Planning Office, Public Housing Authority, the public libraries, the colleges, the medical school, which is UTHSCSA, the Health Science Center, the Transit Authority. And what they did was to try and mobilize those various partners to meet the CDC mandate, which was to implement systems, policy, and environment initiatives to fight obesity in San Antonio. So on the policy side, they got busy, and very shortly after the money came, the city enacted this bicycle policy that says bike facilities must be considered as part of all roadway-related projects that are not further along than 40% design stage. And if you don't include a bike plan, then you better explain to us why you didn't. And so that led to a lot of bicycle striping around the city, new bike lanes, new opportunities to ride, a set of beautiful bike paths. And I spent time on this bike path that I'm showing you here because it's not so far from my house, and I can tell you that my eyeball epidemiology says it's bringing a lot of new exercisers to the fold in a safe environment. These are not lycra-clad people on 21-speed bikes. These are folks who are just starting their journey toward losing the 30 pounds that they want to lose. And the diversity of people is very good. Okay, shameless plug. If you have a couple hours free during the meeting, go to one of the bike share bikes on the Riverwalk. Check it out. That also came out of CPPW, our bike share program. Pedal south for anywhere between 1 and 9 miles toward the missions. And I took this picture 2 weeks ago when the bluebonnets were just coming out, so it's quite beautiful. The grant also paid for fitness equipment to be distributed to about 360 schools for after-school fitness programs, also training for the teachers and how to use it. And that reaches about 365,000 elementary and middle school students in the city. When we're talking about getting kids to school, it also paid for about 7 schools to have safe routes to school programs, and these are considerations of the transportation shed that serves each school. And it's meant to be a comprehensive review of safety, of crosswalks, of speed bumps, of flashing lights, and so on as traffic calming measures, so parents might feel good about having their kids walk to school. Now, obviously, that's a complicated equation, right? Some of it is time factors, and it doesn't just have to do with safety, but evaluations of these kinds of programs from around the country show that they do increase the number of kids who are either hoofing or two-wheeling it to school. The city also looked at combining physical activity resources in places that aren't usually thought of that way. So they looked at libraries, where a lot of parents take small children, and after they feed their brains for a while, perhaps they're ready to run around. So this is a plan since built for a small park next to a library, and they're looking at this kind of situation for various libraries. There's even an adult fitness area there, so if while Dad's there with the kids, he has the urge to do a dozen chin-ups, he can do that too. Now, a lot of the things I'm going to tell you, despite the fact that the grant ended 2 years ago, the beauty of convening all those partners was that it had organizations there with some resources to keep the programs going after grant funding ended. So actually, almost all the initiatives that I'm going to talk about today are still in force one way or another. Here's an example. This is fitness at the park, very early in the morning before our brutal heat kicks in. You can go to one of 50 parks in the city, searchable on the web, by different levels of intensity, different age groups. You can do yoga, you can do dancing, you can do calisthenics. And there's a volunteer fitness instructor there from the Y, from a health club, leading small groups like this. And if you want to try one while you're here, fitcitysa.com, it'll put in where you are and it'll find a place for you to work out. We also started having twice yearly kind of fitness festivals that we called Ciclovia, after a similar festival in Bogota, Colombia. And you know, in the last couple, we've had 60 or 70,000 people from around the city come out on closed streets to do this. And you know, I've been to almost all of them, and it reminds me of something that we forget sometimes, and that's the joy of public spaces, when people can get out together and be active together and look at all the zany things that people do. I mean, people come out with the contraptions like you see here. And you know that this was not only fun for those kids to make that chain of bikes, but they had to try it out, and they'll probably want to ride it afterwards. And so it inspires them to do activities. The city also enacted a series of shared use agreements. The fact that our schools and our schoolyards, the sports facilities, the fields are chained up after school is a terrible loss of a public investment we already made in infrastructure for fitness. And so with a small marginal investment, perhaps a custodian to lock it up very late at night when everyone's done, or the installation of some lights so these facilities can be used after dark by the communities around them, we suddenly multiply, for free almost, the number of fitness facilities available in our neighborhoods. The school districts have picked up the financing of this particular initiative. And you know, again, the thing the city did very hard was to try to target this towards the neediest residents. And this is a request for applications to build bike trails and hike trails at public housing units around the city. And these have started to go up in those areas. They've also had a kind of a linked ride-to-own program. So the kids in public housing, if they go to 8 bike riding classes over a couple months, at the end, they get to keep the bike and a helmet to go with it. It's called Ride to Own, and they've given out over 1,200 bikes in that program. The city put salad bars in 108 schools. That reaches about 100,000 students in our county. If you look at the map of San Antonio, the northwest sector is missing. That's the largest school district in the city where my kids went. The superintendent, when he was approached, said, and by all other regards, a fantastic superintendent, high-performing schools, recently retired. He said, we don't need that. The food in our schools is already restaurant quality. And it was good I wasn't there, because I would have said yes, Taco Bell, KFC, and there you have it. This might be my favorite story of the last year. I was at a school health conference a couple months ago, and some kids actually got up in front of 200 people and presented this. These are students from a middle school in northeast San Antonio. And they started a little community garden, and this pack of 20 students comes to school an hour early each day. And they tend the soil, they water the plants, they harvest, they sell the goods. They sell the goods later on, they take stuff home. The science teacher comes and teaches them about soil and microbes and so on, so they make a learning thing out of it. And at the meeting, I had a woman on each side, and the woman on my left was a teacher. And she said, you know, there are kids at this school for whom this garden was the first non-potato vegetable they ever ate. And the woman on my right was a mother, and she said, my kid never liked broccoli till he grew it himself. So, you know, again, changing the culture of what kids are brought up to eat. That isn't chicken McNuggets. There's now an organization of the businesses around town. This is a coalition to share best practices for employee health incentives, changing the structure of the workplace, for example, to encourage use of the stairs rather than elevators and initiatives like that. And so it's growing pretty rapidly. Now it covers about 150,000 employees in our city. So, you know, does any of this work? Now, as the researchers and public health, people with public health connections in the room know that evaluating these is notoriously difficult. There's no control San Antonio that we can randomize to not do any of the things that we did. But these are the statistics on obesity prevalence in the city from 2010, which was the pre, and 2012, which is the post. And you can see that overall, the obesity prevalence in San Antonio among adults fell about 6% over that period. And I'm not aware of any other city in the country that's reporting this for adults. There's a lot of data coming out now saying that we're making headway in kids, toddlers, not so heavy, preschool programs, but I haven't seen anything with adults. And I think as some of the data comes from other CPPW cities, it'll be interesting to see what the trends are. Even more interesting than that, when we looked at who it was that slimmed down, it was exactly what we wanted to happen. It's the non-white population, which in San Antonio means our majority Hispanic population, that started out with a much higher baseline obesity rate, 40 versus 25%, and they saw the fall. So we're happy about that. As a card-carrying researcher, I have to tell you that it made the 90% confidence interval and not the 95% confidence interval because of the sample size, but we should get more numbers as time goes on. Okay, the connection to primary care. So, you know, I was involved with CPPW as chair of the leadership team, which was kind of the external advisory group, but at the same time I was doing that, I was thinking, as we're learning about all these situational factors that are so important in terms of what people can do, coming up with a way of thinking about that and incorporating it into our work. And so I had been reading some papers and ideas from economics for about 10 years at that point. And this wasn't hard to find. This was a Nobel Prize-winning economist who calls this the capability approach. And his idea is that instead of focusing so much on achievements, we should look at what are people's practical opportunities to achieve, right? Because we can't make people achieve. That's the paternalistic part. You can't make someone do something. But the right ethical claim as a society is to give everyone the opportunity to do something if they would like. And then, you know, in healthcare, when we're dealing with individuals, it's our job to do motivational interviewing and get them to take care of it. But we have to back up and think about what opportunities there actually are. And the opportunities are shaped by two sets of things. What are the resources available? So in the community, are there open fields? Are there places to get physical activity? Is it safe? And so on. A person's income to access those resources for healthy food. And then what the economists called conversion factors. It's kind of jargony, but that's about the person. What are their resources to turn turn a resource into an opportunity? So do you have the health literacy to understand where to find resources? Do you have the social support? Maybe there's a park near your house, but you know, you're home with 3 kids and you need a spouse or a family member or a friend to watch your kids while you get out and take a walk. And especially in healthcare and in the public conversation, so much of the conversation is about choice. It's about that personal responsibility. And the goal of this kind of thinking is to walk back a step and say, can we refocus even a little bit on, you know, because the choices you make depends on the choices you have. So let's look at the choices people have. And we started that work with a set of 14 focus groups in West San Antonio, a heavily Latino, very high obesity, very high diabetes part of town. And in the focus group, we had this very interesting exchange. One participant says to the other who's saying it's hard for her to get activity, well, why can't you just go walking? And the response was, well, because I don't know how to drive. So we unpacked that, and it's a middle-aged woman, immigrant, no driver's license in the United States, lives in a neighborhood where it's really unsafe for her to walk alone, doesn't have the social support from family or friends to have some walking buddies so they can have critical mass. There is no public transportation in the area to take her to a park or another place where she could walk. And so, not knowing how to drive means you can't walk for exercise. We took what we learned in those focus groups and turned them into a set of questions that we then tested in about 300 patients in the safety net clinic where I work here downtown. And these are the percent of people who agreed with these various statements. You can see that fruits and vegetables were available. San Antonio is not as food desert-y as some other communities, although there are pockets here of that. We start to lose about 25% of people when they have to rate the fruits and vegetables as high quality, and then affordability is a big problem. And on the physical activity side, you see almost half the people say it's not easy to walk places for the reasons I showed you at the beginning. In the summer here, we need to be indoors, not like you all from up north. And there's no indoor physical activity for half the people, and 3/4 of them say they're not safe walking after dark. In terms of the conversion factors, partners get in the way. Some people have jealous partners. Some partners refuse to eat healthier meals when someone needs to do that for themselves, and you can see fatigue, illness, and depression are big barriers. And this paper came out in the Annals of Family Medicine in early this year, if you want to look at it. Just one quick slide from the next paper, and then I'll cut out with my research stuff. This is the predicted probability of achieving your 150-minute CDC activity goal as you go from low to high capabilities, measuring on the activity side with our questionnaire. And this is controlling for demographics and choice. This is controlling for people's intentions, their choices to do physical activity. So from low to high, it's about a doubling of the rate of meeting your CDC activity goal. So the argument I'm trying to make is that by understanding and measuring these things, we can get a better grasp on what our patients can really do and give more sensible advice. The way this is working out in the clinic now is I've been lucky enough with some funding from the county and then CMS through an 1115 waiver to hire a cadre of promotoras that we're unleashing in the clinic and also collaborating with our healthcare. And it's a very collaborative model that I don't want to spend a lot of time on now. I can talk about a little bit in the question-answer period. But the promotoras go to people's homes and try to understand what's important to them and what they would like to do. And what we're finding is, this opportunity issue is a very big problem for the patients in our clinic. But the patients, they want to do this stuff, but it's very difficult for them. This is one of the things the promotoras do is an imagine if exercise. They get a piece of paper and they say, draw what you would like to happen. This is a 9-year-old girl's drawing. She weighs 180 pounds. And you can see the things she's dreaming about are being outdoors, under the sun. At the bottom left, she's swimming in a pool. She is running around in an open field, and those are things she never gets the chance to do. That's what she's dreaming of. When we started going to homes, we found that many families don't have any kind of a shared meal. A lot of families don't even have a dining room table. What happens at dinner time is they all go and find something to microwave, some prepackaged food from the store. They microwave it, and they all disperse to their own individual screens, whether it's a computer or a TV set. And there's no family experience of a meal together. And so we're actually trying to start a movement that we named, our promotora model is called Nosotros, for us. And so to link it with that, we call it Nuestra Mesa, our table. And it's the idea of trying to reinvigorate the family meal so people can get together and share not only good food, but conversation. It's about family togetherness and reviving some of the traditions which, in the last generation of the Hispanic community, were very strong around those family meals. This was a picture I took at an event we did about 3 weeks ago, and we signed up 90 families for a year of mentoring from our promotoras on family meals and troubleshooting and seeing how it goes. And our plan, if it works out, is for those 90 families then to serve as mentors for other families in the community and kind of spread a wave. So I'm going to close the slide parts of this with just a few closing thoughts. Health as personal responsibility is exactly the wrong way to think about it, especially on the public health scale. And if you look around, personal responsibility finds its most enthusiastic use among those who want to evade responsibility for unhealthy policies and products. Providing opportunities is the opposite of the nanny state. Opportunities really are a form of freedom, the freedom to pursue the things that you value and to do them, and a freedom that is available to everyone, right, regardless of the level of wealth. If you have wealth, you can buy your way out of few opportunities, but for many people, they're unable to do that. The substantive freedoms that I'm talking about, they come out of the commons, the environment that we build for ourselves as a community. And as I said, society can't make everyone healthy, but I think the right ethical stance is to say we should at least establish the conditions that potentially allow everyone to be healthy. I think of the healthy commons really as a form of collective wealth, a set of opportunities that, we provide for people who can't buy it for themselves. And I'm using wealth in a kind of a non-traditional way. I'm talking about the quality of life rather than the standard of living. And there is an important difference between the two. And the last thing, it's always nice to solve multiple problems at once. And a lot of the things that we're talking about, healthier food systems, healthier transportation systems, more pleasing living environments, they create the conditions for health. They promote social solidarity. When people are out on the commons, there's less crime and there are more opportunities to connect. We promote sustainability if we walk rather than drive. And we protect the environment, right? Because we only have the one planet and we can't foul it up any more than we already are. So I'm going to close and I'm going to be happy to take questions. Thank you.